A very good afternoon and a warm welcome to UBC Lunchtime News on this 15th day of May 2024. We're glad to have you here with us. I'm Loreen Masika Kazimoto. Now we start off with our first headlining story this afternoon. As Uganda embarks on its nationwide census exercise, the International Center for Research on Women remains steadfast in its commitment to leveraging data for the empowerment of women and girls. Despite the challenges inherent in data collection and utilization, Chirabo Subi, a gender economist with the International Center for Research on Women, is optimistic that the census data will provide valuable resources for advancing gender equality in Uganda through evidence-based research. We have more details in this report.
uh,
Well, apologies for that. We'll be getting back to that story in a bit. But for now, the government has procured laptops for each district in the country to support district statisticians in collecting and updating information related to the parish development model. According to Dr. Chris Baryomunsi, the Minister for ICT and National Guidance, the tablets being used for the census shall also be made available to district officials to support other programs. He stated this while handing over laptops to the Minister for Local Government, Raphael Majezi.
The Minister of ICT and National Guidance has handed over the first phase of laptops to the Ministry of Local Government to support in the facilitation of the parish development model. Chief Administrative Officers and Town Clerks shall receive these laptops across the country to monitor and support parish development model activities.
We must do data capture because that was the problem we had. When you get the laptops or tablets at the parish level and some machine at the sub-county level, and then we put a desktop computer in the planning unit, you will not have any reason not to say, I don't know who the beneficiary is. You should be able to capture the right beneficiaries. It should be easy now for you to ensure that you can guide the communities so that we go beyond giving out money to effective utilization of the revolving fund.
The devices used to collect data from the population and housing census shall also be utilized in other government programs at the parish level.
Those very tablets will also be used for the next general election, but the most importantly, we shall hand them over to parishes all over the country. So the parish chiefs can be able to use them to input information and data for PDM.
The Minister of ICT and National Guidance is in charge of digitizing the PDM program through the development of the Parish Development Management Information System.
Because not everyone is eligible to get the money. But we cannot tell if we don't have data, or we cannot tell who is a beneficiary if we don't have information.
The system deployed in local governments has registered 22.8 million Ugandans from 7.8 million households and supported over 10,000 PDM savings and credit and cooperative organizations.
But these numbers, you can just click like this on this system and you're able to generate all the figures. And in that end, it is also helping us to plan.
At least 1.7 million users are part of the system, including cows and government MDS.
Now, the ongoing 5-day National Nutrition Forum, a platform bringing together nutrition stakeholders, has highlighted the necessity for the government to incorporate nutrition interventions into the country's national development plans. Now, officiating at the forum, Prime Minister Robina Nabbanja acknowledged that malnutrition remains a significant challenge and urged all stakeholders to capitalize on partnerships to address this critical issue affecting human health and development. We have more.
Nutrition stakeholders are attending a week-long National Nutrition Forum to find solutions to the critical challenge of malnutrition that the country is still facing. The theme is unlocking nutritionist potential, accelerating multi-sectoral action and strategic investment for enhanced nutrition security.
It really emphasizes the importance of holistic, collaborative, and strategic approaches to promote good nutrition, prevent and manage malnutrition.
Statistics from UNICEF show that 440 million children globally face child food poverty, a situation defined as inability to access and consume nutritious foods in the first 5 years. In Uganda, the Demographic Health Survey of 2022 shows that 2.4 million, a representative of 24.4% of children, are stunted. With these statistics, the Prime Minister Robina Nabbanja has implored stakeholders in nutrition to harness the power of collaboration to fight malnutrition.
Investing in programs that address child undernutrition and stunting levels will improve the health and well-being of Uganda's children and generate significant economic benefits for our country. Uganda responded to these findings by putting in place the Uganda Nutrition Action Plan, which is commonly known as UNAP 2. This is a government-led effort to address the nutritional needs of all population groups, particularly the most vulnerable.
Nutrition Development Partners Group stresses that consequences of malnutrition are a barrier to the achievement of sustainable development goals.
Affecting not only health, but also education, economic prosperity, the societal well-being. And in sub-Saharan Africa, over 30% of children under the age of 5 suffer from stunted growth due to chronic malnutrition, underscoring the urgency of our collective action.
As we advocate for improved nutritional outcomes, it is essential to embrace a holistic approach, as we consistently hear, that recognizes nutrition as a cornerstone of intellectual development, educational success, and economic productivity. We must strive for greater equity in access to nutritious foods, particularly for our most vulnerable populations, including children, pregnant women, and those in rural areas.
Malnutrition and food insecurity have become one of the world's major challenges, and therefore there is need to strengthen agricultural systems to boost food production and supply. Adia Nakute, UBC.
UBC Lunchtime News. Now, in more news this afternoon, the Executive Director, Uganda Cancer Institute, Dr. Jackson Oryema, and other 3 officials have been referred to CID by the Public Accounts Committee of Parliament over negligence of machines and consequently causing harm to cancer patients. The Auditor General, in a report ended June 2023, notes that key medical equipment at the UCI broke down and remained unrepaired, citing an ultrasound machine in the radiology room that has not been used since 2019 because the service provider has not serviced it. We have more details.
Officials from Uganda Cancer Institute have appeared before the Public Accounts Committee of Parliament to answer queries in the Auditor General's report for financial year 2022-2023. The report indicates that the institute was given 48.76 billion shillings, although had a target of collecting 4.5 billion in non-taxable revenues. It collected 3.37 billion, which was an underperformance according to members of Parliament. The Executive Director, Uganda Cancer Institute, Dr. Jackson Oryema, said during the year under review, most patients asked for waivers, emphasizing that all cancer patients are poor. Even those who ask for executive services, UCI subsidizes for them.
At the moment, the country is doing very well in treating the poor because the availability of anti-cancer drug at any one time, if you move into the institute, is between 85% to 90%.
10,000, X-rays 30,000, and then CT scan is 200 to 300,000, depending on the organ that you need to do. Then radiotherapy is, if you're doing one of the advanced techniques, is 1.4 million Uganda shillings.
Officials disclosed that 20% of the patients who go for treatment are from other countries and they get free services as Ugandans, which information did not go well with members of Parliament since it is Ugandans who pay taxes.
Cancer Institute, being a center of excellence for the treatment of cancers within the region, must have that private facility where patients that come in from other countries should actually pay. Why should they be provided services free in this country?
Are these people benefiting from our taxes that we are paying? Stressing the small resources, the meager resources that we are having. I want this to be clarified so that we understand.
Who are coming, actually, as Honorable Penda said, a good number of them are members of the East African Community area. And we do not have a framework within which we should actually charge them.
The Auditor General raised a query of key medical equipment in the institute that broke down and remained unrepaired. The report revealed that a Hawk tow machine found in theatre was not being used because of incomplete accessories.
There's using contractors not approved. There's also payment without procurement files and supply of air.
The equipment to be procured, tested that it is working, with all its accessories, and then you can make the final payment.
In most cases, in most facilities, they do not pay attention to diagnostics.
Just down the road.
Okay,
but, of course, we insisted, we put the supplier under pressure to make sure that that component is actually brought. And as I speak, the machine is working.
The chairperson of the committee, Mwanga Chivumbi, ruled that the equipment lying idle compared to the time lag of procurement is criminal in nature, hence referred the ED, Head of Administration, Head of Medical Services and the Procurement Officer to CID for negligence and causing cancer patients harm.
This committee, beyond reasonable doubt, that there is negligence of duty. Otherwise, you are causing death. I'm referring you to CID right now, after this meeting.
Officials of Uganda Cancer Institute are to be investigated for failure to cost activities worth 5 billion shillings, although Dr. Jackson Oryema admitted to the committee that it was an anomaly. Members resolved to hold the planner accountable in case they fail to give accountability.
Claim that you cannot cost outputs worth 5 billion. This is a lot of money. Where did you put the money? This implies that the activities were not implemented.
But for them, they spend without the costing. So you cannot recost what you have already spent. Otherwise, they will force, and this will not be genuine costs.
Hope the planner will have recovered. Because the statement said here is that he called saying, Mbu, that he was sick.
There has been gaps in the planning process. But work has been done, and that can actually be visibly seen.
The committee will have a guided tour at the institute to assess the progress of the multipurpose building that was funded by a 20 billion shillings grant from Africa Development Bank. I'm Nafka Farida and Gloria Gwetavinji at Parliament.
Now, Now to a headlining story this afternoon. As Uganda embarks on its nationwide census exercise, the International Center for Research on Women remains steadfast in its commitment to leveraging data for the empowerment of women and girls. Despite the challenges inherent in data collection and utilization, Chirabo Subi, a gender economist from the International Center for Research on Women, is optimistic that the census data will provide valuable resources for advancing gender equality in Uganda through evidence-based research.
There isn't enough data or surveys that have been done in the country on which we can best to understand what are the existing gaps for us to do follow-on research. But we are privileged that the census is taking place, and it's one of the indicators for social development. So we shall make sure to utilize this census data in our work as a research institution, focusing on improving gender equity for women and girls. So we are looking at what will be the challenges that still remains. This is what needs to be addressed. At the same point, once the magnitude of the king in the informal sector, so having that data around the health needs as ICRW, we shall look and see what is the gap, what do policy
of 13.66 meters.
In 2020, you remember when we had a lot of rains, the highest we reached was 13.50. But now we are at 13.66 meters.
Minister for Water and Environment, Sam Cheptoris, blames the current wave of El Nino rains around East Africa, especially Kenya.
You know, Uganda, or let me say Lake Victoria, receives most of its water from outside Uganda. The 2025 and beyond.
This is in addition to a clarion call to Ugandans to heed the call for respecting environment laws and vacate buffer zones as soon as possible, since they are naturally flood-prone.
Transforming lives.
Uganda's biggest tourism and travel trade show of the year is here again. The 8th edition of the Pearl of Africa Tourism Expo Poate 20.
Come to your home during the census. Please avail the successful execution of this census will influence the well-being of all Ugandans and progress the country towards the desired socio-economic transformation. I wish you all a successful census for God and my country.
Welcome from that break, and now into the business scene. The Uganda Coffee Development Authority, accompanied by officials from the Presidential CEO Forum, led by Irene Birungi Mugisha, and the Uganda Coffee Promotions Board in
we cannot process this, and the processed one goes at between 10,000 to 15,000.
I felt so sad when I saw people who took a lot of seedling could not succeed. So I want to appeal to prospective farmers, please, there is money in this thing. Coffee is manageable.
Very sure I'll not get less than 40 million shillings in my plantation.
You have seen the 2 acres
And we have a number of coffee farmers in this district. It is unfortunate that the coffee machine that are given to us, engineer, this is unaffordable.
The Atomic Energy Council, together with experts from the International Atomic Energy Agency, is meeting with stakeholders to assess threats to the nuclear industry. The meeting focuses on acquiring knowledge, skills and competences in detection, prevention and response in carrying out assessments regarding nuclear and radioactive materials. The CEO of the Atomic Energy Council, Deogratius Lualida, says Uganda has the capacity, both in regulatory and operational strategy, to deal with nuclear threats.
Measures against any attacks to these prevent